Hi, this is Alfred Brock, and we're going to be talking about some information from NIDA today, and it's going to be about drug facts and what are hallucinogens. And this was revised in January 2016, but the material that we're going to be talking about today is still relevant. Okay? And hallucinogens are a diverse group of drugs that alter perception, that is, awareness of the surrounding objects and conditions, thoughts, and feelings. They're called hallucinations, or sensations and images that may seem real, but they're not. Hallucinogens can be found in some plants and mushrooms, or their extracts, or can be human-made. They can be man-made, they can be manufactured. People have used hallucinogens for centuries, mostly for religious rituals, and common hallucinogens include the following. That's the ayahuasca. It's a tea made from several Amazonian plants containing dimethyltryptamine, or DMT, the primary mind-altering ingredient. Ayahuasca is also known as huasca, aya, and yage. So DMT. DMT is a powerful chemical found in some Amazonian plants, and manufacturers can also make DMT in a lab. The drug is usually a white crystalline powder, and a popular name for DMT is Dimitri. Lysergic Acid Diethylamide is another one. That's LSD. The LSD fame is one of the most powerful mood-changing chemicals. It's a clear or white odorless material made from lysergic acid, which is found in a fungus that grows on rye and other grains. LSD has many other names, including acid, blotter, dots, and yellow sunshine. Another one is peyote, also known as mescaline. It's a small spineless cactus with mescaline as its main ingredient. Peyote can also be synthetic. They call it buttons, cactus, and mesk, and those are the common names for peyote. Now, there's also 4-phosphoryloxy N-dimethyltryptamine, which is also known as psilocybin. That comes from certain types of mushrooms found in tropical and subtropical regions of South America, Mexico, and the United States. Other names for psilocybin include little smoke, magic mushrooms, purple passion, and shrooms. Now, some hallucinogens also cause users to feel out of control or disconnected from their body and environment. Common examples include the following. That's dextromethorphan, DXM, is a cough suppressant and a mucus clearing ingredient that is in some over-the-counter cold and cough medicines. It's in syrups, tablets, and gel capsules, and Robo is another popular name for DXM. Then we also have ketamine. It's used for surgery as an anesthetic for humans and animals. Much of the ketamine sold on the streets comes from veterinarian offices. While available as an injectable liquid, manufacturers mostly sell it as a powder or as pills. And other names for ketamine include K, Special K, or Cat Valium. Then there's phenycilidine, PCP. It was developed in the 1950s as a general anesthetic for surgery. It's no longer used for this purpose due to serious side effects. While PCP can be found in a variety of forms, including tablets or capsules, liquid and white crystal powder are the most common forms. PCP has various names such as angel dust, hog, love boat, and peace pill. Then we have Salvia divinorum. That's also salvia. It's a plant common to southern Mexico and Central and South America. Other names for salvia are diviner sage, Maria pastora, saladi, and magic mint. Now, how do people use hallucinogens? Many people use hallucinogens in a wide variety of ways. And we've got some listing here. They swallow them as a tablet or pills. They swallow them as liquid. By the way, there's going to be a link at the bottom of this video going to show you the information that I'm reading to you right now that you can go over yourself. You can consume it as raw or dried. You can brew it into tea. People snort it, they inject it, they inhale it, they vaporize it, they smoke it, and they absorb it through the lining of the mouth using drug-soaked paper pieces. Now, how does hallucinogens affect the brain? Research suggests that hallucinogens work at least partially by temporarily disrupting communication between brain chemical systems throughout the brain and spinal cord. Some hallucinogens interfere with the action of the brain chemical serotonin, which regulates mood, sensory perception, sleep, hunger, body temperature, sexual behavior, and muscle control. Other hallucinogens interfere with the action of the brain chemical glutamate, which regulates pain perception, responses to the environment, emotion, and learning and memory. The short-term effects of the hallucinogens can begin within 20 to 90 minutes and can last as long as 6 to 12 hours. Now, salvia's effects are more short-lived, appearing in less than 1 minute and lasting less than 30 minutes. Hallucinogen users refer to the experience brought on by these drugs as trips, calling the unpleasant experiences bad trips. Along with hallucinations, other short-term general effects include increased heart rate, nausea, intensified feelings and sensory experiences, changes in sense of time, for example, time passing by slowly. Specific short-term effects of some hallucinogens include increased blood pressure, breathing rate, or body temperature, a loss of appetite, dry mouth, sleep problems, mixed senses such as seeing sounds or hearing colors, spiritual experiences, feelings of relaxation or detachments from the self or in the environment, uncoordinated movements, excessive sweating, panic, paranoia, which is an extreme and unreasonable distrust of others, and psychosis, a disordered thinking detached from reality. Long-term effects. While little is known about the long-term effects of hallucinogens, researchers do know that ketamine users may develop symptoms that include ulcers in the bladder, kidney problems, and poor memory. Repeated use of PCP can result in long-term effects that may continue for a year or more after use stops, such as speech problems, memory loss, weight loss, anxiety, depression, and suicidal thoughts. Now, hallucinogens can cause severe visual disturbances, so you can't trust your eyes or what your brain is recording from your eyes, some of them. The rare long-term effects of some hallucinogens include the following: a persistent psychosis, which is a series of continuing mental problems, including visual disturbances, disorganized thinking, paranoia, and mood changes. Some people also experience flashbacks, which are recurrences of certain drug experiences, and they can often happen without warning and may occur within a few days or more than a year after drug use. In some users, flashbacks can persist and affect daily functioning, a condition known as hallucinogen persisting perceptual disorder, HPPD. These people continue to have hallucinations and other visual disturbances, such as seeing trails attached to moving objects. Now, symptoms are sometimes mistaken for other disorders, such as stroke or a brain tumor. Now, what are other risks of hallucinogens? Other risks or health effects of many hallucinogens remain unclear and need more research. Known risks include the following: some psilocybin users risk poisoning and possible death from using a poisonous mushroom by a mistake. High doses of PCP can cause seizures, coma, and death, though death more often results from accidental injury or suicide during PCP intoxication. Interactions between PCP and depressants such as alcohol and benzodiazepines prescribed to relieve anxiety or promote sleep, that is alprazolam and Xanax for instance, can also lead to coma. Some bizarre behaviors resulting from hallucinogens that users display in public places may prompt public health or law enforcement personnel intervention. While hallucinogens' effects on the developing fetus are unknown, researchers do know that mescaline and peyote may affect the fetus of a pregnant woman using the drug. Now, are hallucinogens addictive? Evidence indicates that certain hallucinogens can be addictive or that people can develop a tolerance to them. Use of some hallucinogens also produces tolerance to other similar drugs. For example, LSD is not considered an addictive drug because it doesn't cause uncontrollable drug-seeking behavior. However, LSD does produce tolerance, so some users who take the drug repeatedly must take higher doses to achieve the same effect. And this is an extremely dangerous practice given the unpredictability of the drug. In addition, LSD produces tolerance to other hallucinogens, including psilocybin. On the other hand, PCP is a hallucinogen that can be addictive. People who stop repeated use of PCP experience drug cravings, headaches, and sweating as common withdrawal symptoms. Scientists need more research into the tolerance or addiction potential of hallucinogens. Now, how can people get treatment for addiction to hallucinogens? There are no government-approved medications that treat addiction to hallucinogens. While inpatient and/or behavioral treatments can be helpful for patients with a variety of addictions, scientists need more research to find out if behavioral therapies are effective for addiction to hallucinogens. So that's what we have for you for today for hallucinogens. I want to thank you for paying attention. I want to ask you to be happy, be healthy. Have a great week. Bye-bye.